Well, now that all American adults are eligible for COVID-19 vaccines, hope is on the horizon. However, for those suffering from long-haul COVID-19, the end seems nowhere in sight. About 1 in 10 people who had COVID-19 may experience long COVID, a condition where patients experience symptoms well beyond the 4-week recovery period. Luckily, our next guest is here to help us out a little bit. This morning, CaringBridge board member Dr. Archelle Georgiou joins us to talk about this issue and how people are sharing their COVID journeys in virtual communities. Good morning to you, Dr. Georgiou. Thanks for joining me.
Thank you so much for having me.
Before we get into these communities, for people who are unfamiliar with this, let's talk about long COVID and what that means.
Long COVID are persistent symptoms after somebody experiences COVID. And as you mentioned in the introduction, about 10% of individuals that have COVID end up having long COVID. So the most common symptoms that people experience are cough, fatigue, shortness of breath, chest pain, joint pain. A lot of people also complain of a brain fog that makes it difficult for them to concentrate. And there are 200 different symptoms that people can have, but they can vary from day to day. They can even vary within the same person. And so for individuals experiencing this, it's a challenging health journey because they feel like they're on a roller coaster ride.
Yeah, absolutely. And there's so much medical professionals don't know about COVID itself, much less the symptoms, right? That in terms of a solution, that seems to be a long way off. So let's talk about what people can do if they're suffering from this. Let's say someone is watching right now. They're thinking, you know what? I've had COVID. I had it weeks or months ago. What are some solutions or some support systems out there for them?
Well, one of the most important things to do is to recognize that long COVID symptoms are real and not imagined. It's not in your head. And that means that it's really important to connect with your doctor and make sure that they hear your symptoms, understand your symptoms, and figure out what medical treatment's appropriate for you, and to make sure that nothing else that's treatable is going on. One of the other things to consider doing is to connect with communities of other people with long COVID. There are individuals that have formed online groups, and connecting with others with the same symptoms means that you can both get the empathy that you need, because the support is so important, but also hear from others about what treatments are working, what's not working. That crowdsourcing of talking with others who have this condition is another way of gaining knowledge and gaining insight to what might work for you.
I'm curious, are there anything that family members or friends can do, right? I mean, this is a mystery in itself. There's so much we need to learn, and it can be difficult for family and friends to find a way to offer their support. What can they do?
Family and friends are so important. So while I mentioned that support groups of other people with COVID are important to share information, having your family and friends and those who love you in a community of a support group around you is also really important. They want to help you. They need to know how. And so using CaringBridge.org, for example, is a very easy and important way to be able to have your friends and family in a private space, and you can share with them what's going on with you, and they can reach back out to you to offer their help.
And we actually just pulled up that information on our screen here as far as the website and the social media handles. I'm curious, Dr. Georgiou, where do you see this going as far as possibly some medical solutions? I know it can be incredibly frustrating for a lot of folks out there. So there's a support system, but do you see anything in the horizon as far as more questions getting answers to them?
Well, we're learning more and more about long COVID, and actually CaringBridge is trying to add to that knowledge base. So on CaringBridge, we actually have COVID-specific resources, the latest research, sites that are specializing in treating long COVID patients, as well as a survey that we really hope that people will complete so that we can add to the research and the knowledge base about how to best treat individuals. But I do have to say that while we don't know how to prevent long COVID, the best way that we know right now to prevent long COVID is to get vaccinated. And so I can't stress how important it is for people to consider vaccination.
Absolutely. I'm glad you mentioned that. I mean, at this point, every adult in the country is eligible to get the COVID vaccine. And that, at this point, is the best way to go about it. Hopefully, people take advantage of those resources and seek out that support. Dr. Archelle, Georgiou, always appreciate your insight. Thank you.
Thank you.